Good afternoon, I'm Mabel Jung, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And I'm so pleased to have with me in the studio Carolyn Quattrocki, who is Executive Director at the Maryland Health Benefit Exchange. Hi there, Carolyn.
Hi, nice to see you.
Well, it certainly seems like Maryland has learned a lot in your open enrollment periods. You've been able to go through 1, 2, and you're getting ready for the 3rd. So tell me what was learned from what you did during the first one and how you applied that to the 2nd.
Sure. Well, as you probably know, we had trouble in the first year with our online application, the website itself. So what we were able to enroll a lot of people, thousands of people despite those problems, and that's a huge tribute to an army of consumer assistance workers and brokers and a lot of exchange staff who worked incredibly hard. But we did want to improve the website experience so that more people could do it online by themselves. And so we adopted the Connecticut technology. It was one of the highest performing marketplaces in the country at that time, still is, and it's been very successful. We were able to do it in time to be ready for open enrollment, and we've gotten terrific feedback from consumers, and the numbers speak for themselves. We were really able to double our qualified health plan enrollment.
Up to more than 125,000,
Yeah.
I think you mentioned earlier, and that exceeded your expectations?
It did exceed our expectations. We're very pleased, and we wanted to have a one-stop shop so that people who are enrolling into Medicaid could use the same application, and we've enrolled hundreds of thousands of people into Medicaid also.
So what are the challenges now going forward? What do you want to even do better than in the first 2 to get ready for the 3rd?
Well, there are a number of challenges, and I think of them in sort of 3 groups. The first is what having a really highly functioning website taught us, if we didn't already know, is that an exchange is more than a website. And in fact, for consumers, particularly who have never had insurance before, they still like to have assistance oftentimes, in-person assistance on the phone. So we really have to work hard to, with declining resources, make sure that we have that assistance available for people, and also continue to enhance the website itself to offer more consumer decision support tools so that more and more people can do it by themselves online. So that's one challenge going forward. The other, another one is that we've really been able to drop the number of uninsured substantially, but the ones left, for whatever reason, haven't heard the message and haven't been persuaded. So they're no longer the low-hanging fruit, and so we need to work even harder to reach them.
What sort of strategies do you plan to implement in the future? What are your goals of the exchange going forward?
Well, we want to, first of all, one of the core missions is to reach everyone who still does not have health insurance. So one of our core goals is to, again, be more strategic and targeted in reaching the people who, for whatever reason, have not heard the message yet and maybe don't understand that this is something they can actually afford, that there's substantial financial help available to people. So, reaching the uninsured, and then I think a second key goal is not just who we're reaching, but what we're offering them, and wanting to make sure that the plans, that we have meaningful consumer choice, that there's a lot of transparency around what people are buying, what doctors are in their networks, so that they make sure that they make the right decision for themselves and their families. So we want to increase both our effectiveness in reaching people and make sure that we're giving them an optimal choice.
And do you believe Maryland is pitching that there are opportunities for people who want to help make this better, and who should meet those opportunities, do you think?
Absolutely. I mean, we think that the marketplace has really increased consumer choice, has made consumers more aware of plan comparison shopping. We think that there's room to grow, so we encourage plans to come into Maryland and issuers to come into Maryland who haven't been here before. I was just in a luncheon where we were talking about issuers that want to be both in the commercial space and the Medicaid space. There are a lot of studies about how people in certain income brackets, what they call churn between Medicaid and qualified health plan eligibility. So there's a lot of room for growth in providing continuity of care and taking care of families. So I think there are tremendous opportunities.
Okay. And what is your final message that you'd like to leave with attendees during this event?
I think the final message is that we have a very great concept here, and it has so much potential for growth. And so getting together with people in all the different sectors and really being creative and brainstorming about how we can better serve the people we're all trying to serve, which are, American consumers who need health insurance.
Okay, Carolyn Quattrocki, thank you so much for your time today.
My pleasure. Thank you.
And I'm Mabel Jung. Thanks for watching.